Hey unicorns, I just got back from my first post-op appointment with my surgeon. I wasn't able to film it because there was a lot of moving parts. So when I first got there, I could tell my heart rate was elevated, as it has been for a few days. But I just figured it was from the car ride and not feeling the best. And just still kind of being kind of paranoid about passing out, because like that's a really scary thing to do. You feel like you're dead, and then it's like somebody comes and snatches you back from the light at the last minute. Only I didn't see no light. All I saw was darkness. So I get there, my heart's elevated, my heart rate's elevated. So they when I got to the back, she checked it. My pulse was 123. And she asked me, had I been drinking water? I said yes, because I have been. But as my doctor explained it to me, you almost have to drink more. Well, not even almost, you do. You have to drink double what you normally would drink in this situation, because they've taken out so much fluids and you have to like force it back in. So I was explaining to her that I was only doing water because when I tried to drink Gatorade, the first day that I was back out of the hospital, it tore my mouth up. Like, it was burning. And I think that was just because maybe I got scratched when they were putting in or taking out the breathing tube. But from what the medical assistant was telling me, that's normal. It usually only happens to every 1 in 5 patients. So if it's gonna happen to anybody, I guess it's gonna be me. But I'm still kind of puffy and swollen. But I drank 6 cups of water back to back to back at the doctor's office. And then they took my pulse again after about 15 minutes, and it was around 89. So what that meant is that even though I am hydrating, I'm not hydrating enough. I still can't tolerate the Gatorade. So I'm going, I have some Pedialyte. So I've been drinking on that. My mom made me some soup to get back a lot of the sodium that I just flushed out of my system at the doctor's office, so I would somewhat stay balanced. And what my surgeon advised me was for every 1 cup of water, 1 cup of Pedialyte, and just keep alternating it out, so that way I don't end up in the ER with another issue because my electrolytes aren't where they're supposed to be. So after that all got calm and I was feeling back to normal, they went ahead and got me in a faja. But before they did that, I asked her to take some pictures for me, and I'll insert them. I just have to edit it, do it just a little blur in the back, because I don't want YouTube to try and say that I'm being nude. Let me pull this up actually, because I got a bra on, but I still don't want them tripping. So I'm just gonna edit that out just a little bit in the back, but y'all will still be able to see everything that was worked on. From what I can see right now, I still have rolls because I'm 3 days post-op, 3 or 4 days post-op, and I'm still very, very swollen. But even in the current state that it's in right now, I'm happy because it still looks better than it did when I first started. I'll see if I can get a picture of the pre-op appointment video that I did, just so you all can see a before and after of what my back looks like. Now again, I fully expect to have some loose skin, but I'm at the point where if it's not unbearable, I'm okay with it. Like, I'm a thick girl. I'ma always have big legs. I'ma always have a big butt. So back rolls would just be expected with that. I'm okay with that. The reason being is because this recovery has been harsher than the other, I'm done, unless it is absolutely necessary. Like, when I look at my back a year from now, and if I'm still having the chafing from the loose skin and stuff like that, then I may consider it. Heavy on the may. But for now, this is my last procedure. I'm done. Recovery is not easy. It's a lot of moving parts. It costs a lot of money. And I just want to be in a place where I'm settled and I'm happy with what I look like. So once all of this post-op swelling goes away, like, I even have swelling right here. I normally don't have 3 chins, but it's okay. it is okay, because I know that this is a part of the healing process. She said I'm healing up really well. I just have to do my part and stay hydrated. So I have a nurse that will be coming today to give me my first lymphatic massage and to also give me some IV fluids, just so I can make sure. But I'm gonna keep drinking until she gets here, well, as much as I can, because I didn't take any pain meds or anything before we left, because I didn't want to risk getting sick in the car, because sometimes hydrocodone does that to me. So I just took my my nausea medicine, what is that, Zofran. I just took the Zofran, and that was it. So by the time we got back, I'm like, my body was screaming. That's why I'm laying down now, because I moved around a lot before I started filming this. So I should be good once the pain meds kick in, to just take a quick nap, kind of decompress. And then when she comes, she's gonna give me some fluids, my first post-op massage, and we'll play that by ear, because my back is so sensitive. So we're just gonna play it by ear and see how much my back can tolerate. If it's too much, I'll tell her no, and we'll just focus on the fluids. But I do want to start kind of getting that fluid moving, and I wanted a nurse to do my massages this time, just in case something happens. I already have a nurse on like right there with me, that can assist my mom if something happens. So, and I made that decision well before I even had my surgery date booked, and I'm glad that I did, considering this time around seems to be a little more risky, and I am just a little more lightheaded. They took out 8 liters. That's a lot. So I'm trying to replenish back my body. I'm making sure that I eat like I'm supposed to. Whenever I wake up, I'll probably get my mom to make me some more soup, because that's full of sodium, since I'm going to be pushing a lot of water, and just to make sure that everything is balanced. But I will include for you all, because I'm in my faja now, so I'll include for you all a picture of me from the front and back with my faja, and then I will also include the before, if I can clip it from that first video, and then the after so far at my surgeon's office. So for now, I'm back in the bed. I'm fine. I'm well hydrated. My heart isn't racing. I'm gonna take a nap, and then when I get up, it'll probably be time for my lymphatic massage, and then I will do another check-in with you all. But just know, if you are a plus size patient, there's more risk. There's more risk involved than what I will admit that I realized, only because my first recovery was completely fine. Outside of my legs swelling due to me being scared to sleep in the bed, which was my doing, other than that, it was fine. Like, I didn't have any issues with passing out. I didn't even have any issues with staying hydrated. So this has definitely been a learning experience, and I'm gonna tell y'all everything. So just know, if you are getting plus size cosmetic surgery, your aftercare is going to look different from someone who is at their ideal BMI. Research, and make sure that you have proper aftercare, because that will not only help with the results, but depending on what's going on, it may save your life. So I am about to go to sleep. Whenever I wake up, that's when I'll upload this video and insert the photos. Or maybe no, I'm gonna stay up, because it only takes 10 minutes. I'll stay up and edit this so that way y'all can have it in real time. And then tonight, after my lymphatic massage, then I will make another update for you. So, all right, unicorns, let me get to editing this video and posting it. And until next time, as always, stay magical. And this is just the before picture that I clipped from that video. This is the after. Keep in mind, I'm still very swollen, but so far I'm liking what I see. And then these last 2 pictures are just the front and back and my faja. All right, unicorns, until the next